Today our topic is hydrocephalus in pregnancy. Little we have to know with I will do this recording with the visual and audio both are there, and then you will find this video and audio in the YouTube. So the first question is that why do baby develop hydrocephalus? Hydrocephalus that is present at birth is referred to as the congenital hydrocephalus. So, congenital hydrocephalus is caused by a complex interaction of the genetic and the environmental factors during fetal development. What are the causes? The most important causes of the congenital hydrocephalus is aqueductal stenosis, brain malformation, like for example, Dandy-Walker syndrome and Cherry malformation, and then the spina bifida. After that, we are going to let to have a means recording of this how we are going to how the hydrocephalus is treated. So this both pictures I am going to put it on
Hydrocephalus is a
this hydrocephalus and how the hydrocephalus is treated. It will be in the YouTube. Okay, after that mean hydrocephalus diagnosed in pregnancy. Hydrocephalus can be detected using a normal ultrasound examination, which is typically performed throughout a woman pregnancy. Means mostly we are doing in the second trimester is 18 to 22 week, which we call it anatomical scan. And during this ultrasound scanning, the means technician or the means sonologist may pocket or find out the pocket of the fluid in the developing brain. This will indicate the large ventricles and the possible presence of hydrocephalus. Then hydrocephalus can also be detected as early as the lateral part of the first trimester. Diagnosis can be made as early as 13 week, around 20 to 24 week. Abnormal dilatation of the ventricles are more clearly detectable. But in certain special cases, fetal MRI may be done, especially when abnormal anatomy is observed with the sonography. Then MRI provide more detailed images of the brain. Then we have to go to the monitoring of the hydrocephalus in pregnancy. Hydrocephalus in pregnancy is managed by observing your baby with a regular ultrasound. At this time, there is no fetal treatment for this condition. So, mostly the treatment is after the delivery of the baby. So, throughout the pregnancy, it is important to have a series of ultrasound to monitor ventricular size. There is no way to predict whether the ventricular size will increase or decrease in subsequent studies. But anyway, it is generally felt that if the ventricular size remain stable, the fetus can be followed at up to term. The best way to improve the outcome of the baby is to delay the delivery until the fetus is mature enough as much as possible. So the doctor will also determine if a vaginal delivery is an option or if a cesarean birth is recommended due to the size of the baby head. A progressive if sorry a progressive ventrilomegaly, that is if the ventricle continues to enlarge, if demonstrated for several options are we have to consider. For fetus younger than 32 week, the risk of the pulmonary lung hemorrhage may be weighed against the potential damage of the progressive ventricular and early delivery. Then the second thing is that for fetus with a diagnosis of spina bifida, means pre or postnatal surgery is an option to close the baby back before or right after birth. Then we have to go to the fetus older than 35 week. A preterm cesarean section may be performed and a shunt may be placed postnatally after birth. Once hydrocephalus in pregnancy is established or suspected or established with the relationship with the pediatrician neurosurgeon contacted as early as possible is important. The baby may need to undergo treatment quickly after birth. The pediatric neurosurgeon can provide you the details and the best treatment option for your child. Now the question, most important question is that one, the how the hydrocephalus treated in babies. The goal of the treatment is reduce the pressure inside your baby brain by draining the excess fluid, like this is we call it cerebrospinal fluid. We have to perform a detailed neurological exam at birth, along with the examination of the head size and the soft spots. Means the on the frontalis will be done to verify the diagnosis of the hydrocephalus. Then, how the hydrocephalus is treated. This means recording of the video will be downloaded in the YouTube along with this one, with this topic along with this. If there is an increased pressure on the brain at birth, hydrocephalus is treated with one or three the surgical option. Means what are the options? Shunt system, the most common treatment of hydrocephalus is a medical device called the shunt system. So these are the shunts they are placing it. So a shunt is a device that allow the pressure in the brain to normalize by draining the fluid to another part of the baby of your baby body. Now, most often the abdominal cavity where the fluid can be absorbed another side. So the other thing, the tube from the brain is connected to a valve. They help to regulate how much fluid leaves the brain. So the goal of our goal is placing the shunt is to allow the normal brain development. Then the thing is that endoscopic third ventricular ventriculostomy, ETV. So this ETV is a surgical treatment option typically used for the children over the age of 2. With non-communicating obstructive hydrocephalus. So hydrocephalus caused by the blockage in the brain, like aqueductal stenosis. Not everyone is a candidate for ETV treatment. The other treatment is the endoscopic third ventriculostomy, ETV with the choroid plexus cauterization, CPC. The third treatment option involves the ETV with the addition of a procedure called the choroid plexus cauterization. This treatment is primarily used in the children under the age of 2. And if you want to have a further learning, then you can visit the site I will give you. So, what is the prognosis for the baby with hydrocephalus? Many baby born with hydrocephalus go to lead a full life, though the road of this your child might be the road you journey down together, means with your baby. So do not depress. Baby with hydrocephalus grow in the resilient and determined children. Thank you so much, and the recording along this the theory part, the recording will be there. Only this topic is only to understand that what is this hydrocephalus, because mostly we this abnormality we are not coming in our life in our sites.